Here are 10 common mistakes you make when going to get your blood tests done. And you make this last mistake because it's extremely frequent and widespread, and it's a natural behavior that can actually end up causing you actual harm. So stick around until the end because you're going to make a checklist. You should write down all these points, these 10 common mistakes, so you never make them again. Shall we get started? So, these 10 mistakes, why are they so important? Because if you make any of these mistakes, it can have a direct impact on your test results and give you a false result, a false change that could completely alter your treatment. So, this is really serious. And since I've worked in a lab, I know these mistakes happen. For a long time, I interned at a big lab, and many times I was the one who did the patient's initial paperwork. So, a few questions can change everything. Let's start with the 10 mistakes. So, mistake number one: should you take your medication before or after your blood test? For example, thyroid hormone. Should you take it before the blood draw or after? And what about blood pressure medications? Do you need to take them before or after? And for diabetes, do you know the answer to each of these questions? Let's see if you got it right. Pay close attention. I suggest you write this down, like I mentioned at the beginning. If you take thyroid hormone, thyroid medications, you should take them after. After you have your blood drawn, okay? Because if you take it before, it can interfere with the results. And what about blood pressure medications for your heart? What should you do? Should you take them before or after? You should take them before having your blood drawn, okay? Otherwise, you could have a spike in high blood pressure, for example, right after the test. These medications have a set schedule. And now, medications to lower blood sugar levels. What should you do? Here we have two scenarios. First, there are patients who are at risk for hypoglycemia. For these patients, I suggest you take it after your blood is drawn. Why? Because imagine if your blood sugar level is very low while you're waiting for the blood draw and you have a hypoglycemic episode there, a very serious situation. It could have severe consequences. So, talk to your doctor first. If you're taking medication for diabetes, as a rule, metformin, for example, after your first meal, okay? So, this is the recommendation for whether to take medications before or after. If you take any of these medications that I haven't mentioned here, a type or class of medicine I didn't talk about, leave it in the comments and I'll answer whether you should take it before or after your blood test. Number two, be careful with multivitamin supplements. I'm going to give two examples here. Many individuals who regularly use specialized vitamins for their hair and nails, which often contain high levels of biotin, also known as essential vitamin B7. This vitamin can affect thyroid test results, for example. And you should preferably avoid these multivitamin supplements for 72 hours before your blood test, because otherwise you could have significant interference in your results. Another example here is those multivitamins that contain vitamin C. Vitamin C can interfere with several tests. Cholesterol, it can interfere with glucose, it can interfere with uric acid, and vitamin C can even interfere with the fecal occult blood test. It can give a false result. Did you know that? Look how important that is. Sometimes a person has bleeding, but because they're taking vitamin C, the vitamin C can mask that bleeding. And the problem here is with the test. In the test tube, in the lab, I if you are, taking vitamin C can cause interference in the test tube, okay? When it's time to look at the test to analyze it. It's not that vitamin C is going to change all of this in your body, okay? This is about blood tests, all right? So you also need to be careful with these multivitamins with vitamin C before a blood test because it can cause a pretty big change, as you saw there. Mistake number three is getting a blood test done when you're sick, when you're not feeling well. Why? When we're sick, for example, with the flu or a common cold, you can have changes in your white blood cells, your leukocytes. You might see changes in inflammatory markers like C reactive protein or erythrocyte sedimentation rate. You could also have changes in your cortisol levels, for example. So, several test results can be affected. And also your blood sugar levels. So, a complete blood count can show a number of changes. Okay. So, I suggest that you postpone the test if you're sick or have the flu and reschedule it for a day when you're feeling well, when you don't have any health issues. Okay. Because that way we can really analyze the test results accurately. So, you're going to have a change in your white blood cells, doctor. Let's see. Is this change something temporary or is there really another problem? Will it require further investigation? Okay. So, here's another tip. This is a mistake a lot of people make. Mistake number 4 is about fasting. Does drinking coffee without sugar break your fast or not? And what about drinking water with lemon? Does that break the fast? And sparkling water or cold water? What do you think? Let's get into it then. This is also a very common mistake. And the point here is that any drink except water will break your fast. Even if that drink is coffee without sugar, for example, just plain coffee. Why is that? Just the fact that you drink coffee can also interfere with several tests. So, the fast that the lab refers to is a complete fast from liquids as well, even those without calories. This idea that, but the liquid doesn't have calories, but it can have other substances, and that can cause a significant interference in your results. So, only water. When it comes to sparkling water or cold water, all of that is allowed. The issue is with other drinks. For example, coffee, which I've seen many people drinking. Oh, but are you fasting? No, I'm fasting. So, what'd you have? Did you have coffee? Oh, I had coffee, but without sugar. Just plain black coffee, right? That's not a problem then. And then the person had to postpone the test because of that. That's what I used to ask. Imagine if I hadn't asked. The person would have taken the test and could have gotten a false result because of it. Mistake number 5 that you make when getting blood tests done. Not everyone makes this mistake. It's often talked about, but even so, it's worth highlighting because it's very common, which is the fasting time. When you're going to take a test, for example, a fasting blood glucose test, what kind of fasting? How many hours? How long should you be fasting? Do you know the answer? So, between 8 and 12 hours. A lot of people know this. You can't mess up by fasting for less time than required. For example, taking the test after fasting for only 6 or 5 hours. But many people don't know that fasting for too long can also cause a big change in your results. Shall we go on then? If you fast for less than 8 hours before a fasting blood glucose test, for example, the test can be influenced by your last meal. It could be that your body is still metabolizing that sugar. That meal can affect your results. But it can also go the other way. A lot of times, people fast for 13, 14, even 15 hours. And why shouldn't you do that? Why is that not recommended? Because when you go beyond 12 hours, first of all, you lose the scientific study reference point. That's an important factor. But also, your body can enter a different metabolic state. And it starts telling your liver to produce sugar, as well as releasing counter regulatory hormones. What are these hormones? Cortisol, glucagon, they can increase. Growth hormone as well. This can affect your test results. So, fasting should always be 8 to 12 hours. Mistake number 6 is leaving out the use of hormones, supplements, or substances. A lot of times when they ask you at the lab, what medications do you take? You'll mention, right, blood pressure meds, diabetes meds for high uric acid, isn't that right? You have to mention those. Now, other substances matter too. For example, herbal medicines, some supplements, even vitamins themselves, as we've already discussed. Hormones, like the ones you apply to your skin, for example, those are the main ones. Hormones like testosterone, hormone pellets, estrogen. Oh, am I taking any medication? I don't take anything. But are you using any hormone cream? Oh, yes, I am using it. That used to happen really often. And why is this so important? Because it will change the way the doctor analyzes your test results. Hormonal creams, for example, will influence or supplements that the doctor knows sometimes may contain hormones or supplements that alter some test results. In the case of testosterone, for example, creams with testosterone or estrogen will significantly alter your test results. And if the doctor doesn't know about this, when it comes time to decide on a treatment plan, it can change things drastically. So let your doctor know about everything you're using: creams, supplements, vitamins, even if you don't think it's important. Number 7, doing vigorous physical activity the night before or the morning of your test. Before having your blood drawn, this right here, I've seen this happen many times too, and it's a big mistake. Why? A lot of people follow the fasting instructions, mention their medications, but don't pay attention to this issue of physical activity. Many people are in the habit of working out, going to the gym, for example, early in the morning at 5 or 6 a.m. And then you go to the lab fasting. Oh no, I'm fasting. I'm following all the rules. But you're not paying attention to this issue, the physical activity part. If you work out at the gym before having your blood drawn, what can happen? You might have changes in your liver enzymes, your creatinine levels could be affected, and this can also influence your doctor's decisions, and you could end up with a false diagnosis. So you really need to respect this. And the night before, like at 11 p.m., for example, I also suggest you don't work out then because it can interfere. There are some studies that show this. Vigorous, high intensity workouts, okay? Number 8, and this one, when it comes to thyroid and cholesterol, is one of the most common mistakes, all right? What is this mistake? Not respecting the minimum time interval between tests. This also applies to glycated hemoglobin. If you're taking a test that will check something that needs time to change, there's no point in doing it earlier because not only will it not work, but you'll also harm your treatment. I'll explain it to you in a second. Are you undergoing treatment for diabetes? And if your doctor ordered a glycated hemoglobin test, you need to respect the minimum interval of 90 days. Why? With a glycated hemoglobin test, you'll see the average blood sugar levels from the past 90 days. Sometimes you're undergoing treatment and want to see if it's working, right? So after 2 weeks or a month, you take this glycated hemoglobin test, but this test will still reflect the period when you weren't on treatment. The same goes for thyroid tests. Here, the waiting period's a bit different. The ideal is at least 6 weeks, okay? 6 to 8 weeks, just like cholesterol tests. And since it's a hormonal test, in the case of the thyroid test, the body also needs time to adjust to the new hormone dose. This happens a lot. The doctor changes the hormone dose, but the patient doesn't wait the recommended time, and the test reflects that. If you do the test before the recommended waiting period, the results come out altered. The patient brings them to the doctor, and the doctor changes the dose again. And then you end up in that cycle, that roller coaster of thyroid test results. Have you ever gone through this? One time it's way too low, another time it's way too high, and the doctor can never manage to stabilize your hormone levels. This happens a lot, really a lot. Is that your case or not? Tell me here, have you ever done a thyroid test without respecting that minimum waiting period? And the same goes for cholesterol tests too.
All right.
Cholesterol causes a lot of anxiety. Oh, my cholesterol is high. I need to get tested to check. Here's a big catch. Okay, so you have to wait for that minimum period. And this is one of the biggest mistakes. And the ninth mistake, we're almost at the last one you make, huh? What is the ninth mistake? The ninth mistake is getting your blood drawn the day before your doctor's appointment. This really messes up the doctor's approach and the appointment itself because some tests, especially hormone tests, as a doctor, an endocrinologist, a thyroid specialist, I often deal with this too. Because sometimes the patient gets their blood drawn the day before, leaves it to the last minute, or thinks it'll be better that way because the results will be more up to date. But thyroid tests, like the thyroid stimulating hormone test, TSH, usually take 72 hours to be ready at the lab. So the test will still be pending. The doctor won't be able to make a decision. You'll have to come back later to show this test result. And other tests too, but especially hormone tests. Yeah, they take longer. So make sure to get them done at least 4 days before your appointment, or 5 days before your appointment, at the very least. Deal? And what's the 10th mistake? This one I see all the time. Tell me if I got it right. Okay. So, what is this 10th mistake that you can't make? A lot of people, when they schedule blood tests, for example, cholesterol tests, but especially for diabetes, blood sugar, about a week or a few days before, they start changing their diet. Like, oh no, on Wednesday, I won't eat a lot of pasta. I won't eat bread. I won't eat this dessert that I usually have because on Friday, I'm going to get a blood test. So I know it's going to affect the results. Do you think that's right? I'm not going to that restaurant. Oh no, I'm going to take care of myself. I'm really going to watch my diet. And they end up creating an artificial environment to take blood tests. Diabetes tests, cholesterol tests, for example. Why is this so wrong? Because you should take the test as part of your usual routine so the doctor can really see how your situation is. There's no point in trying to change your triglycerides, for example. There's a test where even if you follow a strict diet for a week, your fasting blood sugar might change a little, but that's not your real situation. You're just creating a fake environment a week before, which isn't what you actually do in your daily routine. And the doctor needs to have a real understanding of how your health is. Have you ever made this mistake? A lot of people say, oh no, I didn't eat that kind of thing this week. Isn't it right? It's human behavior. I get it, but it can really hurt you. Out of these 10 mistakes I mentioned, how many do you make? Or used to make, right? You're not going to do it anymore. Right here for me, out of these 10, be honest and tell me which city you're from. I'm from Porto Alegre. Now, I'm going to give you a suggestion. You already know the things you shouldn't do, but there are also 7 mistakes you make in the morning that can spike your blood sugar levels. You can never make these mistakes in the morning again. If you click on this video here, you'll be taken to another video where I talk about these mistakes you can't make in the morning. Take care. See you next time.